Welcome to today's episode of Wellness Wednesday. I am Dr. Katherine Y. Brown, your host. I am excited to introduce you to today's guest, Dr. Tracie L. Agusta. Welcome, Dr. Agusta.
Thank you so much for having me.
Here's what I found.
I appreciate the invitation.
Absolutely. And I see Siri is chiming in too over there. So for our viewers around the world, I want them to know about your background. So the first question is simple. Who is Dr. Agusta?
Okay, that is the way you put it. That is such a good question. That means that I have to be self-aware. So let me tell you who I am professionally. So I'm Dr. Tracie L. Agusta. I am a nurse practitioner, certified as an acute care nurse practitioner, which means I can see patients in the inpatient setting, in the hospital, emergency rooms. And I also am a family nurse practitioner, which means that I can also see patients out in the community and in their homes. I'm also a nursing educator, which is something I really enjoy. I've been a nurse almost 30 years, and I've been an advanced practice nurse for a little over 15, almost 20. And so nursing is something that's in my blood. It's what I do. I'm a mother of 3 adult children, one of those being a physician, in which, you know, what parent doesn't want to say, oh, my child's a physician, but I'm a mom and I enjoy doing that, and I have being that, and I have 2 grandchildren. So professionally, that's who I am.
First of all, amazing. You don't look like you have been doing anything for 30 years.
Thank you. That's in those genes. That's mom and daddy right there.
So as it relates to your work in terms of wellness, COVID-19, what are the things that you have been doing in your community?
So that's a great question. And it's so funny how things happen before you even know that there's a need. So back in 2016, I started my own practice, which was primary care. And I was seeing patients in a clinic setting. After about a year and a half of seeing those patients in the clinic, I decided to begin to go and see those patients out in the community. So I began to do mobile health. And what I found, it was such a need with mobile health, because there are a lot of patients in the community who can't get to physicians, they can't get to doctors' offices, they need home health, they have comorbidities that keep them from coming outside the home. That was even before COVID ever hit. And so I began to see patients out in the community. Another thing that I found, whether I was seeing patients in the office or seeing them in the community, everybody usually has the same question. Anytime you give them a medicine, you give them a diagnosis, the first thing they say is, what else can I do? People were always looking for other ways to deal with illnesses and the things that they were going through without having to be on medication, or if they did have to be on the medication, what else can they do to make things better? That put me on a road of wellness and wholeness, because illness is just not, in Western society, we only deal with the physicality. We never deal with the other things that can cause illness. And in order for a person to be well, they have to be whole and not just physically whole. A person's body can be just fine, but if they're stressed, if they're lonely, if they're heartbroken, if they're emotional, if they have other things going on in their lives, if they have a poor diet, if they don't have access to certain things, we can be unwell spiritually, emotionally, we can be broken, and all of those things are factors in health. And so that put me on a journey of not only spirituality, but also understanding the body as a whole. And that journey took me actually back to school, where now I'm studying spirituality as it relates to healthcare. And so with that comes that wellness, that comes wholeness, and that comes with bringing the whole body back into alignment. So in the last 3 years, that's what I've been dealing with, is really putting that back together for us. And that's something that I like to consult on and actually talk to people about, is wholeness, the whole body, not just taking the medicine, but also mitigating your stress, eating properly, loving yourself, and all those things that come with that.
Absolutely.
I know it's a long answer for one question, but it's a lot. It's packed.
Yeah, because I mean, it sounds like you started pre-pandemic, and your work has continued and has evolved. Is there anything that you changed as it related to your work during the COVID-19 pandemic? Was anything different in your approach?
It was different because during COVID, more people began to care about themselves, and
Mm,
wellness became more of a buzzword during that time. People had to spend more time alone and with themselves and
yes.
with their families. And that's when we saw mental health become a big issue. We really had to start dealing with people differently. We couldn't just deal with people on the basis of here is a disease process, here is a diagnosis. We really had to start dealing with people more holistically. We were having patients from an inpatient standpoint. We were having patients to literally be in the hospital and die and never saw another family member.
Mhm.
How do you deal with that family later? We were having people that were emotionally sick in the hospital, couldn't see their family members. They didn't care anything about they were sick and had COVID. I want to see my children. I haven't seen my grandchildren. There was something that was happening, a thing that was stirring, and we had to begin to start talking to people differently. I just couldn't come in the room and talk to you about your COVID. I had to talk to you about other issues because who else were you going to talk to? Who else was going to deal with these issues? And so we began to deal with patients a little bit differently as people began to deal with themselves differently. So
Okay.
that change, and that's something that we're still dealing with today. Even with you doing the series on Wellness Wednesday, it's in that vein of exactly where everything is right now. Self-care and wellness is where everything is going. Historically and traditionally, especially as Black women, we're so used to taking care of everybody else. Everything has been externally located. We're okay if everybody else is okay. But on the inside, we're crying in the shower or sitting in the car too long just to have a moment for ourselves. As we have begun to evolve, more people are starting to see that nobody else can be okay if I'm not okay.
That's
I
right.
have to begin to focus on myself. I can't put my children first if I'm sick. And so I think that that's a realization that society is coming to, and even us as Black women who have what we call superwoman schema, and that's an actual thing. A lot of research around that paradigm that Black women love to live in. We take care of our children and our relationships and our jobs and our bosses at the neglect of ourselves.
Mhm.
And you find more people starting to drive in their lane and say, hold on, I'm gonna take a bath a little bit longer. I'm gonna put some oils in here and some flowers, and I'm gonna lay back and leave me alone. I lock the door.
That's right.
You find more of us starting to do that because people are starting to understand it's time that I take care of myself.
Absolutely. I love it. So, Dr. Agusta, how can people connect with you to find out more about just your work if they want to follow up after today's episode?
So what I did, of course, I didn't say this. I no longer have the practice, which
Okay.
I will be restarting it once I finish this journey. I'm coming to the end of one journey and getting ready to restart another one. Or not
Okay.
restart, but it's going to be new. But I did reopen my Facebook page, which is Spirituality, and I have to pull it up.
Go on and pull it up. Take your time. We are family on Wellness Wednesday. And because, I know that our viewers are listening, and we didn't talk, the entire time just about COVID, but what we did talk about was wellness. And in which you share with us is the construct of total health, which is physical health, mental health, emotional health, spiritual health. You're talking a new landscape, which looks different. And so it is that 365-degree me. And
Absolutely.
it's a conversation that, many healthcare providers talk about, is that during the pandemic, healthcare providers they were giving out, and there was very few people to give in. I mean, they spent hours caring for
Hours.
patients. Even the researchers that were doing the research spent hours, or the people that were
Absolutely.
getting information to the community, they spent hours pushing out, and they really didn't pull back in and take care of themselves. So
Absolutely.
yeah, and that's why I say I really want you to be able to share your information so people can read about the work that you're doing, because you were doing this pre-pandemic.
Mm-hmm.
You pivoted during it, and now you're reimagining based on our new normal. Dr. Agusta, I would almost dare to say that anyone who, like you say, you stopped it and started it, I would dare to say anyone who is not taking a moment to restart their business is actually doing it an injustice, because we all need to reimagine, because we're not living in the same normal that we lived before.
Absolutely. Absolutely. Everything has changed. In fact,
Yes,
and you hit on such a good point about the healthcare providers. A lot of nurses left the bedside.
that's right.
The burnout was so severe. Watching the death, watching the pain, people walked away. And they found, and you may have even seen online where nurses and doctors were crying. It
Yes,
was a hard time because their families were also being neglected.
that's right.
Because as people leave, you have to fill in. And then you're there for hours and hours, and the emotional toll that it took on so many people. And then a lot of people went traveling. It was so many things happening. But our norm now is different. There's a new norm.
That's
And the
right.
norm, and it's something that we have to move into the healthcare system, this whole wellness issue. How do we operationalize that in a healthcare system? And also, from a Black woman's perspective, how do we inform? How do we inform physicians and other people who don't look like us that we have separate needs?
Yes.
Because the research has already told the story, and that Black women are the most spiritual women on earth. Black women are always looking for another way to take care of everybody at the neglect of themselves. And so when we come into the doctor's office and we're taking our medicine and our blood pressure is still high, we're taking our medicine, the blood sugar is still high. If the physicians don't understand that there are stressors, there are there's even research that says that the microaggressions that we deal with at work affect our heart. All of these things are laid out already in the research. So how do we operationalize that, and where we can get the health care that we deserve? Because of course, you know that our numbers, and statistically we fall behind any other group of people when it comes to cardiovascular disease, and that includes high blood pressure, diabetes, high cholesterol. We're constantly falling behind. But it's not that we're not taking our medicines and we're not doing what we're supposed to do. There are stressors that we're not mitigating. We're not dealing with our spiritual health. And when I say spiritual health, I want people to understand spirituality and religion are two different things. Most of us have plenty of religion. We grew up in the church, but that's sometimes to the neglect of our own spiritual health. And spirituality is the foundation of it all. So we get so used to the ritual, but we forget about the spiritual part of it.
Oh my
It's a
goodness.
lot. It's a lot. We could talk all day and go down all of these different avenues, but it's a lot.
Okay, Dr. Agusta, I gave you time to get your contact information, so I'm coming back around. Do you have it?
I do. So the Facebook page is called Spirituality, Cardiovascular Disease, and Black Women. And the moniker says at Dr. T Holistic Mystic, because holistic is where I'm going and it's where I'm going to stay. So spirituality, cardiovascular disease, and Black women. I restarted that Facebook page about a week and a half ago, and I'm going to start adding more and more content. The first thing I added to it, though, was a survey. And if you don't mind, I'm going to plug this survey right quick. The survey is for my dissertation. And what the survey is looking at is Black women who have high blood pressure, and it's a spirituality survey. So it's just for Black women with high blood pressure, and it's a spirituality survey. It takes about 5 minutes. It's not a long survey, but it's really looking at how we feel. I want to be able to inform the healthcare system how Black women need their spirituality attuned to when you're giving us these diagnoses. Most of them will say, well, I don't have that. Let me talk to my pastor first. Well, not until God says so. Well, my God didn't agree with that. How does that play into our health?
Okay.
I want to be able to talk to the healthcare system about that right there. Because if we can get them to understand us as a people and what's important to us, I think that the guidelines and the things that come out will begin to be inclusive of at least asking, are you okay?
All
Are
right.
you really okay?
Right. Are
And
you
exactly. Is there something else that you need? Do you need to talk to anybody? Is there something going on in your life you tell me you're taking your medicine, But is there something else? I believe you're taking it, but your blood pressure is still so high. What else can I do for you? Are you okay? Is it something you want to talk about? Even that, when I do that, and as a Black woman, maybe it's just coming from me. Whenever I ask somebody that, you know what happens? The patient begins to cry, male and female. When you just take that pause and you speak into a person's spirit and say, are you okay? Mm-hmm. See, what's from the heart reaches the heart. They know, if you just say it, that's one thing. But if you mean it, and if I ask you, are you okay?
Yeah.
A lot of times, male or female, that patient will cry. Mm-hmm. And you can begin to minister to them. And I ain't saying all doctors can minister, but at least if you can't talk to them candidly, you can make that referral. There are so many nurse practitioners and physicians now that are dealing with just that. Mental wellness, mental health. And we're not talking about big diagnosis. We're talking about, hey, I just need somebody to talk to. My children are all grown and there is nobody at the house now but me. And all I know how to do is be a mother. I need to talk to somebody. As simple as that. It doesn't even have to be big. But until they make that recognition that there is something. I spoke to a young lady in the emergency room not too long ago, and she was being very aloof, but she kept cutting her eyes at me, and we weren't the only two in the room. So I finally walked over there, and I put my hand on her back, and I said, are you okay? And she burst into tears and just revealed that she was in a domestic violence situation. She had a 3-month-old. She was pregnant again. She didn't know what to do. And I said, are the children safe? She said, they're safe. I said, are you safe? And she said, no. We would not have ever gotten that out of her without that moment. We were able to get her help that night. But she was not ready to just talk about that. It was me walking over, putting my hand on her back and saying, are you okay? Just 3 words can change a person's life because a lot of times they're looking for the door. They just need somebody to just open it just a little bit. I came here to tell a story, but I'm looking to see if there's anybody that's willing to hear it.
I love it. Dr. Agusta, you have reminded us to ask those 3 words. Are you okay? And for those viewers around the world, please, if you need help, reach out to your healthcare provider and someone that you trust to get the help that you need. And if you're a provider, know that sometimes it's okay to not be okay, but there's help for you in your communities. For our viewers around the world, you've just met Dr. Tracie L. Agusta. Her contact information is going to be listed below. Dr. Agusta, this was your first time on Wellness Wednesday. I certainly hope it is not your last. We will have to have you come back after you finish your work on the survey and all of the amazing things that you are doing. And thank you for your service, for your work, and just for your commitment to helping people to not only be well, but live well. So we're sending a virtual heart to you.
Thank you for having me. This has been an awesome time. I know I have a lot to talk about in this short amount of time, but thank you just for the window.
Oh, absolutely. And I am sure you are going to get people to follow up with you because after we drop your contact information. So please like, share, follow this message. The community needs to meet Dr. Agusta. Until next time, I am Dr. Katherine Y. Brown, your host. Have a great day, friends. Oh my goodness, Dr. Agusta. Wonderful, wonderful.